so they know where they're going so they can serve the customer very well? I didn't know that. You know, it's very interesting because the federal government instituted something in the 1990s called HIPAA. Anybody know? You know what HIPAA is, I'm sure. The Health Insurance Privacy Act. And at the time, it hasn't been fully implemented yet because people have been trying to stop this going all the way. And what it was touted as was something to protect your privacy. Yeah, to protect your privacy for your health records. And what did it do? It prevented the insurance companies with whom you privately contracted and the doctors with whom you privately contracted from sharing information, even though you could see whether they would do this and you could move to a different company if you were displeased. It was voluntary. They stopped that. The federal government, contrary to the Interstate Commerce Clause of the Constitution, which is only written to stop states from imposing tariffs on each other, they interfered and they said, no, you can't do it. You're not going to be allowed to do it. We, the federal government, under this Privacy Act, this Orwellian title privacy, will get your information. We will take your health information. We will be able to get access to it anytime we want it. And we'll hold the information. We'll keep it safe, just like the VA information that was, not kept safe. Sorry. Whoops. We'll keep it safe for you. And that, of course, is so wonderful because it conforms so well to the Fourth Amendment against unwarranted searches and seizures. It's great because it's for our own benefit. It doesn't have to do with a crime or anything like that. It's just your health records. So we're going to keep your health records for you, and that's privacy. Now they want to take the last step, and the supposed conservative potato head egomaniac Newt Gingrich, who's opposed to the First Amendment because, of course, we're in a supposed war on terror and have to stifle free speech on the internet. He wants to have a team of judges, as long as they all had prior military experience, determine what could or could not go out on the internet. Yeah, that was one of the things he said a couple years ago, that brilliant teen jerk that he is. Newt Gingrich, who also, by the way, was in favor of the Medicare Part D program, the prescription drug plan that the real conservative George Bush, the biggest spender up until Barack Obama in history of the United States presidency, the one that he pushed, which was going to be $1 trillion liability over 10 years, continued to take money from a neighbor to give it to other people so they could get drugs. Oh, but that means we all care. Okay, sure, punch my neighbor in the face too. Take his blood and donate it. That'll mean you care too. It's incredible to see how these people do this. Newt was behind that too. And they all patted themselves on the back because now Democrats are working with conservatives. Newt worked with Hillary Clinton on this, so obviously it's got to be great. It's incredible. And they say it's going to streamline things, right? Well, I'll tell you, I had a very enlightening conversation with a woman in the Nashville, New Hampshire region who works in radiology at one of the hospitals in the region. There are a number of hospitals in the Nashville, New Hampshire region in southern New Hampshire. I'm only going to say her first name. She doesn't want her last name mentioned. Her name is Barbara. We had a great conversation, Barbara and I, about just what the federal requirements already do to their paperwork burden and what their attempt to try to do the electronic record-keeping stuff will do. She says, look, if there's an incentive to do this privately, we'll get involved with it. But right now, it's very difficult to try to do electronic record-keeping totally because you always have to back everything up. If the federal government starts to impose this on us, she says, you know what they're going to do. They're going to have all sorts of regulations. They're going to have all sorts of things you've got to do with these papers. She says, we already have so much time taken up by government-required paperwork in the first place. It's an absolute mess. It's going to get even worse. They're not going to save any money. She says, let the market work it out. We'll find ways to save the money if they allow us to move the information around based on what the customers want. But we can't do that right now. Why? Because the government doesn't let them. You see how they set this up? Well, it gets even worse. Listen to the rest of this report.
The president also addressed his critics on the toughest sell he'll have for his plan, how government-run public insurance would work, arguing it's not a first step toward a full-fledged government takeover of health care.
Who will give warnings about socialized medicine and government takeovers, long lines and ration care, decisions made by bureaucrats and not doctors. We have heard this all before.
Okay, so Barack Obama is trying to make you think that anyone who criticizes his plan as a push towards a single-payer socialized system is just offering up tired old canards, oral shibboleths that have no foundation in fact. Well, first, before we get to the oral foundation in fact that we can provide to you, that I've researched, that other people have researched, and that has been highlighted very selectively around the media, I'd like to go through a very brief history of how we got into the situation we have gotten into under the government that has screwed up health care. Let's set down the key reasons as to why there are problems. First, under Franklin Delano Roosevelt, the U.S. government imposed wage and price controls on businesses. Businesses could no longer try to attract good employees by adding them an incentive of higher wages. Because, of course, Franklin Delano Roosevelt didn't like that, and, of course, he's the President of the United States of USSA, and he can do whatever he wants. They should have taken him out, slugged him a few times, and then put him in jail. That would have been fun. But they didn't do that. And that started the tradition of people expecting that when they worked for a company, they would get an insurance policy, some sort of a health insurance policy. Because the companies were trying to find ways to attract good employees, so they offered them health insurance incentives. It was non-monetary compensation. Okay? So that starts that tradition. Then you've got Medicare and Medicaid and various federal requirements forcing doctors to give service for those things. All right? That forces cost shifting to the people who actually pay for their insurance, their private plans. Then in the 1970s, Ted Kennedy pushes a group insurance plan where if you have 20 or more employees, you will be able to write off your expenses for health care in your business. And that drives people who are the employees of the business to then take their health plan from the business that they're working for rather than buying their own, because they can't buy their own and write it off on their taxes. So that grows HMOs. That grows managed care. That gets people more paperwork, all these types of things. You get more bureaucracy, consolidation, and it just starts to snowball. Then in the 1980s, 1990s, you had this push by the various states to regulate insurance companies, particularly private individual insurance companies, to have to accept people with pre-existing conditions, to put people in what they call group rating. They call it guaranteed issue or guaranteed access when you have to accept people with pre-existing conditions. You can refer to our previous podcast on the Judd Gregg plan, which is also insidious and disgusting. And what does that do? That drives costs way up. You get people waiting to get their health insurance until after they get sick, so you don't have that clean money going into the system. The companies have to raise rates. More people drop out. Rates go up and up and up and up and up. Okay. And by the way, under the HMOs, you get overutilization because people don't see it as paying their own bills. They think the company is paying for it for the HMO. They think their business is paying for it. So they use their health insurance plan for virtually anything. It used to be used much less often. You get this overutilization that drives costs up. So that's where we get to this point. This is the oral evidence I want to present to you. And it's pretty indicting. In this next audio, you're going to hear the very worthwhile Glenn Beck tell you about a video he received that was originally made by Veriserum.com. And he and his staff added to it with more that they were able to find on the web. And I found some more, and I'm going to, as I said, I'm going to make a separate audio of something that will really, really stun you. I've actually posted the video at the Liberty Conspiracy. You can see it. Now, both versions of what Glenn Beck posted and what Veriserum did are available on our video player on our website at libertyconspiracy.com. And we're going to begin first with Barack Obama in 2003. Listen to him talk to a crowd about how he favors a single-payer system, eliminating the private insurance market.
I happen to be a proponent of a single-payer universal health care plan. As all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate.
You heard him, openly advocating it. We knew that ages ago he was in favor of this.
But there's a new twist to it. As these forces and pressures come around, he's not saying it overtly anymore. This supposed desire to provide merely just a government competitor in the market is coming out. We're hearing this so much now. Oh, we're just going to provide a government competitor, that's all. We like competition. That's what they call competition, taking people's tax money to create a new force that will push other people out of real private marketers out of the business. We're hearing this a lot, but they're not phrasing it the way I have. Here, Obama tells us a little bit in May of 2009 to make us feel less nervous. He's changing his rhetoric. Listen.
So what I've said is, let's set up a system where if you already have health care through your employer and you're happy with it, you don't have to change doctors, you don't have to change plans, nothing changes. If you don't have health care, or you're